Hi, my name is Bladen Kettler, and I'm here to go over an assessment of the lungs, heart, thorax, and the abdomen. To start out, we're going to ask our patient to face back this way, and we'll examine the posterior side. So looking at the posterior to start out, I'm going to palpate, checking for symmetrical expansion of the lungs. If we could ask her to take a deep breath. Good. One more time for me. Good. Okay. Next, I'll go ahead and percuss the posterior lung fields. To do this, we're going to move in a systematic manner, so I will be moving from left to right. And you should be listening for a tympanic sound when doing this. Next, I'll go ahead and auscultate posterior lung fields. Again, we'll do this. I'll be moving from left to right and top to bottom. It's important to move in a manner like this because you want to be able to compare both sides. All right, you can just take a deep breath for me. Alright, now I'm going to ask our patient to turn and face this way for us, and we'll inspect the anterior portion. So start out with the anterior portion. Go ahead and we'll feel any lumps, any abnormalities, bone deformities, anything like that. I don't feel anything. Next, we can go ahead and percuss the anterior lung fields. Again, we'll be moving side to side. Next, we'll go ahead and auscultate the anterior lung fields. Her lungs are clear to auscultation on both sides. Next, we'll go over the heart assessment. For the heart, at first you can examine the chest, look for any pulsations, anything like that. Next, we'll go ahead and auscultate the heart. To auscultate the heart, there's 5 positions you can move through. There's the aortic, the pulmonary, the Erb's point, the tricuspid valve, and the mitral valve, also known as the apex of the heart. When auscultating the apex, it's important to listen for a full minute. Now we'll go ahead and do that. Just relax. Now we're going to turn from our diaphragm over to our bell and listen again to the 5 positions of the heart, just see if we hear any murmurs or other sounds. And do not hear any murmurs. Now we'll go ahead and ask our patient to lay down on the table for us, and we'll go over the abdominal examination. So for the abdominal examination, you want to go ahead and expose the abdomen. And to start out, we're just going to go and take a look. We want to make sure the abdomen is symmetric, the skin is normal. Next, we want to go ahead and auscultate. The reason we want to auscultate before we start palpating, at times palpating can cause you to hear which you may believe to be abdominal signs, so go ahead and auscultate before you decide to palpate. I'm going to start auscultating in the left lower quadrant the right lower quadrant, and then we'll move my way around clockwise. Okay, it's also to remember when auscultating the abdomen, when trying to listen for bowel sounds, to listen for at least 5 minutes. Next, we'll go ahead and we'll lightly palpate the abdomen. We want to take note of any masses, lumps, anything we feel. Do not feel any masses or lumps or abdomen. Next, we'll deeply palpate the abdomen. We'll ask the patient if they feel any pain. Also, we'll take note if we feel any masses or lumps. Do you feel any pain?
No.
No?
No. No.
No.
No.
Okay, next we can go ahead and palpate for the liver and the spleen and the kidneys. You should not be able to palpate the liver, the spleen, or the kidneys. If they do have an enlarged liver or spleen, you may be able to palpate it. So to do this, we'll take our left hand and support the patient's back, and this is for the liver. We'll take our right hand and we'll ask the patient to inhale, and while they're inhaling, we'll move our hand underneath the ribs and see if we can palpate the outer edge of the liver. Can you take a deep breath for me? Okay. We cannot palpate her liver. For the spleen, similar to the liver, we'll take our left hand, support the patient's back. Over here under the ribs, we'll take our right hand again, ask the patient to breathe and try to feel for the spleen. Cannot feel our spleen. And for the kidneys, typically you will not be able to palpate the left kidney. Some patients you may be able to palpate the right. Again, we want to support the patient's back. We'll feel with our right hand. And I cannot feel the kidney. Last, we'll go over some common locations for palpating a pulse. To start out, you have the radial pulse on both arms. Right here at the wrist. Let's see your other arm. And when checking people's pulses, try not to touch your thumb. Your thumb can make it seem like you may be feeling a pulse that you're not feeling. Next, we'll go over the dorsalis pedal pulse and also the posterior tibial pulse. I'm going to take your leg and bring it up. So for the dorsalis pedis, we'll feel at the top of the foot here. And she does have a good pulse. Normal, I would say about a +3. And that is in both feet. And for the posterior tibial, lower this foot and bring this one up. For the posterior tibial, lift your foot up. You feel right behind the malleus here. Palpate with 2 fingers. You should be able to feel a pulse in both feet. And she has a good pulse here as well. And we'll check the other one now. Okay, sit up. Okay, and that is an assessment for the heart, lungs, thorax, and heart. Thank you.